Access to healthcare is one of the hottest debated topics in the U.S. today. As of 2016, more than 27 million people were uninsured. Another 50+ million were on Medicare. Where do people go when they need access to affordable quality healthcare, but cannot find a provider to see them? For millions of people, community health centers provide an answer.
A community health center is the safety net provider for the uninsured Medicaid, Medicare population in our community. The healthcare center movement started in 1964-65 as a civil rights program to really identify the poor and vulnerable in each of the communities that they served. And so from that standpoint, we began to really look at the needs of who was receiving care and those that were in socially impoverished areas, how to create an atmosphere where they can receive health care.
Community health centers are so important for America. They take care of millions of people throughout the United States. They take care of patients in rural areas, in towns of 300 and 400. They take care of patients in the middle of the largest cities we have. Some of these community health centers are the last line of defense. They take care of patients when they have no other place to go. They don't care if you have insurance or if you don't have insurance. They're going to provide the same high-quality care.
There is a misperception that the majority of our funding comes from federal funds, and that is a misperception, as a great amount of our funding comes through patient revenue, state funding, county funding, organizations, foundations, employee giving programs, and private donations.
Many health centers are recognized as patient-centered medical homes, a standard shown to be related to better clinical performance. They use state-of-the-art health management methods that result in the highest quality of care for patients, as well as less hospitalizations and emergency room visits. As the future of healthcare reforms are uncertain, community health centers plan for a lasting future.
The healthcare centers adapt and change in policies based on the needs of the community. And we've always had an opportunity to reevaluate how services are rendered, what types of services, and what delivery model that we want to create. Healthcare centers have a unique way of providing opportunities to establish different types of programs through our foundation model to help establish different forms and levels of care.
Nevada Health Centers prides itself on providing access to quality healthcare services in urban, rural, and frontier areas throughout the state. As the largest provider of primary care in Nevada for both insured and uninsured populations, NVHC offers medical, dental, behavioral health, and pharmacy services at more than 150,000 visits to babies, children, and adults each year. In addition, we help deliver women's, infants, and children's services to more than 330,000 residents annually.
Nevada Health Centers began in 1977, where we established our first rural area healthcare center. We just celebrated our 40th year of service in the Nevada community. Nevada Health Centers is the largest FQHC in the state of Nevada. Nevada Health Centers has 17 site locations, including mobile services, dental services, behavioral health, pharmaceutical services, and other types of community healthcare outreach programs.
The Nevada Health Foundation is the fundraising philanthropic arm of Nevada Health Centers. We are celebrating 1 year of being officially in operation, and it was really the brainchild and strategic vision of Walter Davis, our CEO, to provide another avenue for donors, potential donors, to really contribute to our programs and services. Currently, our revenue stream is made up of 51% is patient revenue, roughly 27% is through HRSA funding, federal funding, and the remainder of those monies are generated through foundation donations and grant awards.
Community health centers play a critical role in healthcare reform, serving as a safety net for millions of Americans with the capacity to grow in a cost-effective manner. Community health centers believe all people have the right to health care. Their mission is to ensure they continue to provide services to everyone, regardless of their economic or insurance status.
At Nevada Health Center, we think we have the best job in the world. We get to take care of patients all over the state. We take care of patients in small towns. We take care of patients in big cities like Las Vegas. We get to provide everything from dental health to primary health care like family practice and pediatrics. So one of the best things that we get to take care of the people with Medicare, Medicaid, those within private insurance, and those without insurance. We don't exclude anyone here. I'm a mission-driven provider. I work because there is a mission to take care of those that are underserved. It's our job, I believe, to be there at those difficult moments.
Nevada is a geographically vast state with hundreds of miles between cities and towns, addressing needs like distance, housing, medical supplies, and access to enhance specialty resources requires an innovative model.
Adaptability has always been a key to our success of making sure that we reach out to the community, understand what the community needs really are, and to provide that level of service there. Telemedicine is a way for patients to come into a location where there's not a primary care provider located there physically. However, we can provide through telemedicine an electronic feed so the provider can see the patient, discuss their concerns with them, and then the patient is treated for their issue or their illness. And that's what we're most proud of everyone that's here, working in our community, working in our facilities every day, understand that our mission here is to really take care of people, and we leave the rest of the financial worries of those concerns outside of the patient room, because we want to make sure that their healthcare needs are met every day.
When I hear stories about a young child that received his own toothbrush for the first time, or someone that is a homeless patient that is now ready to get back out into the community because they received medical and dental services, or the woman who received a mammogram screening in rural Nevada, and although she was diagnosed with breast cancer, she now has a chance to live a healthier life. Those are things that make me know that our mission is alive and well.
To learn more, visit us online today.